Good evening and welcome to TalkSports, our weekly sporting program where we speak with the movers and shakers in sports, the sportsmen, sportswomen, sometimes the administrators, just about anyone who involved in some way or the other with sports. Well, for the past 2 weeks, I should say, we have been dealing specifically with the COVID-19 and how, to some extent, it has been impacting society and to an extent, sports as well, because tonight's guest, will kind of give segue into how that is affecting the COVID-19 society and to an extent, as I indicated, sports and other recreational activities and what have you, the way of life, as we will say. Well, tonight, our special guest is no stranger to the airwaves when it deals with medical issues. It's Dr. Terrence Marryshow, also known as Dr. Terry Marryshow. And Dr. Marryshow has gone way back many years ago. Probably he was one of the very first doctors, I would say, medical experts who took to the airwaves, among, I should say, both radio and television. And for many years, prominent feature on the media in Grenada, giving medical advice. Let me welcome Dr. Terry Marryshow to the TalkSports program for this evening. Dr. Marryshow, good evening to you.
To all of your viewers and listeners, and thank you for your kind invitation to appear on the program.
Right. It's a pleasure having you on the program and dealing with a very, very important issue. Last week, no doubt, we had a sort of response initiative from the Grenada diaspora in terms of the COVID-19. And this week we decided, let's continue on that and get what we will call from the ground, a sort of reaction from on the ground. And what has been happening. So first of all, Doc, thanks again for being on the program. And as a mere introduction, the situation with the COVID-19 in Grenada, 1 year plus since, things, since the outbreak, I should say, of COVID-19, how would you characterize the situation with COVID-19 in Grenada?
Well, I would say we have gone from being one of the very best in terms of our management of this disease locally to where we are now, where we are considered as one of the worst. And that for me is a very sad and depressing chapter in our history, because as far as I'm concerned, we didn't have to be in that situation, the situation that we are in today. We did an excellent job managing this pandemic over the last year. There's no question about that we were regarded by the Center for Disease Control of the United States as one of the better countries in terms of management. We were considered as a country that was safe to travel to, and people were able to travel to the United States without any restrictions. Today, there's an advisory against traveling to Grenada. And that is because of what has transpired over the last 3 weeks, when we have gone from really, really good management internally to what I consider today as a travesty when it comes to the present situation in Grenada, where dozens of Grenadians are now dying, thousands of cases. In fact, as we stand, as of yesterday, there were 85 deaths, compared to one death that we had up to the 27th of August. We now have approximately 4,550 confirmed cases, and active cases as many as 2,200 cases at this present time. Now, I say it didn't have to be like that because we are in a really, really privileged position, not only in Grenada or in the Caribbean, but in the world at large, because we had done such a good job managing it, and people were looking at us and wondering what was Grenada doing so differently that we could have had such a wonderful situation where we only had one recorded death as of August, and it was an imported case who died subsequently. And then all hell broke loose. We had a situation where what I would consider as the conditions leading to a perfect storm, because we have a population that is largely hesitant where taking the vaccine is concerned. And around the carnival period, despite all of the warning from the government that there should be no carnival type activities, they were restricted. They took away the 2 days of holiday that we normally have of carnival, Monday and Tuesday. They took them away, so there were not supposed to be any activities of that nature. And coupled with the fact that right around that time, we were beginning to identify the Delta variant, which had come into Grenada, and isolated a few cases. And people, in defiance of the law, in defiance of all of the norms that the Ministry of Health and the government tried to establish in Grenada over the period, decided to do their own thing. As they say, the mask have to play, the jab have to play. And we saw an explosion of cases over the last few weeks, from virtually none to now over 4,000 cases. And Grenada on an advisory list where travel is concerned. So we have not done a good job, and I cannot entirely blame the government for this situation, because we can look at a lot of things in hindsight. Hindsight is 2020. And the only thing I probably could blame them for is even encouraging any form of activity around the carnival period when permission was given to hold certain big functions or parties. But in terms of the general management of the country, in terms of management of the pandemic over the last year or so, they've done a wonderful job. Not only that, they have procured the vaccine for us at tremendous odds when other countries couldn't even get it. We were privileged to have the vaccine right here, the AstraZeneca vaccine that came in. And all that was required of us is for our people just to understand the importance of taking a vaccination, which was going to save their lives, prevent severe illnesses, prevent hospitalization, and a custom that we have in Grenada, which is stellar when you compare it to other countries as well, because we have a very robust vaccination program at the primary health level, where children are vaccinated from the time they're small right through school age and what have you. And we don't complain about that. We vaccinate our children, we bring them to get all that is necessary for their growth and development without complaining, without even finding out what is inside of it, what does the measles vaccine contain, what does the polio vaccine contain. We didn't even question these things. But in the era of social media, in the era of information and misinformation, in the era of WhatsApp and Facebook and all of that, where a lot of misinformation was bandied about over the last year or so, where some even renowned people came out against the vaccine and a lot of misinformation was spread. Grenadians bought into that. We bought into that lock, stock, and barrel. And instead of getting a vaccine that was available to us, which other people wanted, we decided not to take it. We became vaccine hesitant, and the vaccination rate was very, very, very slow. Up to this point, we only have maybe about 22,000 people who are fully vaccinated, and maybe 33,000 who have the first dose of the vaccine. So it is still very, very slow, even in the face of all of the data that started to take place in Grenada. And there's one point where I was saying to myself, maybe what we needed in Grenada is something like this, just morbidly saying something like that and sarcastically saying that when I saw the response of Grenadians to the vaccine and the number of arguments I kept getting into with ordinary people trying to educate them, and all they can give you is answers for every single thing. They became doctors overnight, they became scientists overnight. They knew everything about everything. So it wasn't a lack of information, it's just a lack of misinformation which they are bought into. And so instead of embracing the vaccine, which would have prevented this dire situation that we find ourselves in today, they bought into the lies and the misinformation and the conspiracy theories and all of that, to the point where today we have a very critical situation in the country, where over 4,000 people and more are infected with this virus, and the possibility of it being transmitted, because we know the Delta variant is highly transmissible, it's highly infectious, and it is spreading through the society like wildfire. There's some people who don't even know how they get it. They have not even left their houses, and they come and they get tested and they're positive. So that we have community spread as well, which is something that we didn't see in Grenada prior to August of this year. So the situation is dire, it is serious. And the only way we can get out of it is still the jab in the arm. You know, people want to play jab, but they're afraid of the jab in the arm. I don't know what is the problem with this. I mean, I understand it. You know, from a medical point of view, I understand it. You're afraid needles, they listen to a lot of misinformation, and they buy into that, and they thought, you know, the vaccine was developed too quickly, they don't know what is in it, as if we ever knew what was in anything that we use, even the medications that we get from the doctor on a regular basis. We don't know what's in it, but we take it. The doctor says, take this 3 times a day, and you don't even question that you take it because you realize it's for your health. And when we should understand that this is the same thing that applies to the vaccine, and we should be buying into what the science has told us, that the vaccine is going to save your life, it's going to prevent you from serious illness and death, we decided to do otherwise and now find ourselves in this situation.
Doc, so do you think, apart from all these things, the misinformation and all the other things that you have mentioned, there was a level of complacency among Grenadians regarding the COVID-19?
I think so. I think that level of complacency came about because we had managed it so well. You see, we managed it well, but in managing it well, there was still a level of hesitancy when the vaccine came into the country. So when people should have embraced it, and where today, instead of being in a sudden and depressing situation that we are in today, where we are counting deaths, we'd have been well on the way to open up the country again. We had a golden opportunity. We missed a golden opportunity. Every time I think of it, it's something that gets to me, because we had such a marvelous opportunity to embrace the vaccine, especially after we had managed it so well internally, that we would have been right now in a position not only just to open up, but we would have been one of the countries that would have been looked at as a good tourist destination, because there would have been hardly any cases. And secondly, we would have been way ahead of all of the other islands of the Caribbean in terms of the economy, because we would have been able to open up earlier, and we would have been in a much better position economically today, rather than to be struggling as we are struggling now. And that only has to do with the fact that people became so complacent that they decided, they have the saying that God is a Grenadian. So because we managed it so well and we hardly had any cases, people decided, oh no, we won't get through this otherwise. We don't have to vaccinate ourselves. We don't have to follow the dictates of the government when it comes to vaccination. And we have rights, and we have this and that and what have you. And in so doing, we allowed a situation to come like this. The only people we have to blame for this situation, Mike, is ourselves. That is you can only blame ourselves for this situation, because we allowed this to happen. With all of the information that has outside there about what the vaccine is going to do for you, with all of the information that we have about what the virus does, the deadly impact of the virus, and how many people died in the United States, over 650,000. We're so close to the United States, we get all of the information on a daily basis. And instead of trying to prevent that from happening in our own country, when we had the means to prevent it, we allowed it to happen.
Well, in addition to that, Doc, even New York, for example, where a lot of Grenadians themselves died of the virus, it was at least an indication of what to expect if you don't do. And as you say, Grenada had a very good head start. Well, for those of you who already put in your comments there, though, you can still ask Doc some question. I'll read it out to him. But Doc, important enough though is that the point you're making in that it sets Grenada back so much to the point that it also having an economic impact. St. George's University, for example, one of the major employers of the nation, already indicated that some of the students are free to return, and if they're free to return to the United States, it means lack of employment opportunities for a lot in terms of rent and rentals and a lot of things. So by and large, it is having an economic impact on Grenada.
Exactly. And you see, we weren't thinking about the broader picture, the bigger picture, which is that Grenada is a struggling country as it is. We spent a whole year trying to fight this pandemic. And when we should have been in a position now to attract the students back, we know that the impact that the medical school has on the GDP of Grenada, which is tremendous. And when we should have been welcoming them back, but welcoming them back in a situation where the majority of the Grenadian population would have been vaccinated, because the school was also mandating that the students returning should be vaccinated as well, that workers working there should be vaccinated as well. And when the general population should have been looking at that, we settled for short-term gain to play a little piece of mass for 2 days, and then disregarded the bigger picture, which is the impact that the COVID-19 pandemic was having on the economy, and that if we had to shut down again as we have shut down in the past, that can only be devastating for us as individuals and by extension the entire country, because it means that you have to go back to a lockdown situation. It means businesses have to close, businesses have to go out of business as well in certain instances, because if you can't make money and you can't keep your business afloat, then you have to shut down. And only for short-term gain, and that's what it was all about. And it's such a I every day I feel it. I feel disgusted. I feel it in the pit of my stomach when I think about it, because we lost a golden opportunity, and only because people just don't understand that you have to take individual responsibility sometimes, and when you fail to do that, it affects the general population as a whole, which is the kind of situation that we are in today.
Mm-hmm. All right. Good evening to you, Edwin Sam from in New Jersey. Good evening. And there's one, Carla Mahon is saying most people have the concept that the vaccine is killing people. Doc, again, some of these.
What is killing is the COVID-19 virus, and especially the one that we have now, which is the mutation of the original one of the Alpha, which is the Delta. It's much more infectious, it's much more deadly, it spreads faster. That is what is killing us, not a vaccine. Vaccines have by and large been saving our lives throughout history. Millions of people's lives have been saved because of the vaccine. And this one has saved millions of lives, because we saw even in the United States as it is. Initially, there was a surge. Millions of people, thousands of people were dying, to the point where 650,000 people died. But once the vaccine came on stream, that number dropped considerably. What we are having right now in the United States, as you see, is a surge again, but mainly among the unvaccinated people. So I don't know where this notion of the vaccine killing people comes in, and you're supposed to be so scared of it, because that is certainly not the case. You might have the odd cases, people who have comorbidities or pre-existing conditions that may have been weakened, in the course of time, and the immune systems are weak and die, but not really from the vaccine as such, because the vaccine is not designed to do harm to you. The vaccine is designed to help us to fight this dreaded disease that has come upon us in such an unexpected way. That's all it is about, So the people who continue to buy into that and don't vaccinate themselves, they are putting themselves at risk, and they're putting other people, their families, their friends, other people at even greater risk.
Mm-hmm. But do you think also, Doc, that while yes, by and large, the government has done quite a lot in terms, and health officials, that the misinformation has been overwhelming to the point where many Grenadians consume what is believed to be misinformation / fake news rather than
Than the
taking things
science.
from the medical experts.
Rather than embrace the science. That's one of the main things that has fueled this vaccine hesitancy, because they have listened to so much of the negatives, all of the conspiracy theories. Because most of us, we tune into CNN, we tune into all of these Americans, say NBC, ABC, all of these. We have television that's a beck and call at our disposal every single day. So we are listening to all of this information, and there's a lot of misinformation, disinformation being bandied around, and people have just bought into that, and they say, oh, they say that, and this person say that, and they say, and that's all they continue to do. And this misinformation, Grenada is already. One of the rumors starts, and before you know it, by the time it reaches 10 people, it has changed up so much. And that's the same thing that's going on right now, because once somebody says that the vaccine is killing people or it causing blood clots, even though they reported, okay, the incidence of clots after using the AstraZeneca is 0.001% among the population. But that becomes the norm, that the vaccine causes clots. And if you take that, you'll cause blood clots. I mean, how people even know coming to me and saying, okay, they want to take it, but they're scared they'll get blood clots. And I said, listen, the vaccine is safe. The possibility of you getting blood clots is 3 in a million. So just don't worry about it. You don't have to worry about it. Grenada doesn't have 100,000. I mean, it doesn't have a million people. So don't even worry about it. If you're going to get a clot can be treated, but you cannot treat death. You can die from the vaccine. I mean, from the virus, but you cannot overcome that. You have to be sensible. This time is a time for common sense. What is the point in not vaccinating yourself and just seeing people die around you and then not understand that, something is going on here, that it is not a vaccine that is killing people, because you're not taking the vaccine, so it's not a vaccine that is killing people. It is the virus. And we have bought into it so much that, one person tells another and another tells another, and then this goes from, home to home, and then people just get scared and they're hesitant, and that's what has fueled what is going on right now in Grenada. And it's a sad situation, because, we, again, as I say, we could have been in such a better position today than we are in today, instead of, being able to open up and show the world what we have done as a country, that we embrace the science and we are smart people. What we did, we fall into the same trap as all of those misinformed people, and cause the situation that we are in today.
Doc, do you think it's quite alarming for you and others that in probably a period of 4 weeks, 6 weeks, that 80 plus deaths in Grenada COVID related?
Well, it's not alarming to me, because I follow the science. I read extensively on this, and I see how this virus moves. In fact, anytime I get information that is relevant, I try to share it with people. And very, very early in the pandemic, I shared a graph that showed you the exponential way that this thing increases on a daily basis, on a weekly basis, and over a period of a month. So for me personally, that is what I was trying to avoid. Every time I appear on a program, I speak with passion about the need for us to continue to fight this, the need for people to continue to embrace the science and get vaccinated, because I feared what was going to come, and my worst fears have come to fruition. When we now have over 4,000 cases in Grenada, and 85 deaths. This is the kind of thing we used to look at in the United States and say, wow, we hope this will never come to Grenada. And sadly, it has.
Yeah, I know it's a situation that is, well, quite alarming. You say not for you, but quite alarming for others, because 80 something deaths in a matter of weeks. Yeah, in a month. So obviously it is something that
And there's
unprecedented
some,
historical
really
proportions.
good, resourceful people, that people who never really expected at this time in their lives to die from COVID-19 have passed away. Some, again, through their own folly because they refused to be vaccinated, and others innocently because those around them wouldn't get vaccinated. So the hesitancy has fueled that, and some people have innocently gotten the disease. But again, by and large, it is an individual responsibility, and as I said, people have to accept responsibility and take responsibility for their actions. And it's not, again, for lack of good internal management, it's not for lack of the availability of the vaccine. In fact, they were saying at one point, they want choices. And I said on a program, listen, beggars can be choosers. We are lucky that, and I say it in a pejorative sense, but in the sense that when other people were struggling, they want the vaccine, we were able to get it very, very quickly enough, and since February. And between February and now, we haven't even choices. So if people had embraced it between February and August and September that we are in now, can you imagine if people had actually, used up most of those vaccines instead of, in some instances, we had to give them away because people weren't using them and we didn't want them to expand our hands, so we had to give them away. And then now you have, the choices that they want. Again, we can't consider ourselves more fortunate than that. In this case, I can't say beggars can't be choosers because this is one time when beggars are choosers, because we have AstraZeneca and we have Pfizer. I mean, how many small countries, poor third world countries, have that privilege today that we have and have squandered it in a big way?
Let me get a comment there. Alana John is saying, good evening. I shared space in the office with two other co-workers for 2 weeks. In the second week, one of them tested positive. 5 days after, the other tested positive. I was the only one who was fully vaccinated and did not test positive. So I can say that the vaccine works, at least in my opinion. Doc, any of those experiences of you have heard of probably from folks in terms of real life stories, I should say, regarding being vaccinated?
Yes. And I mean, only recently I started doing some testing myself in my clinic. And last week, Tuesday alone, between Tuesday and Wednesday, I got 7 positive cases. And, this is just a clinic just doing a limited amount of testing. Imagine what is really outside there. And I've seen and heard from so many people, who have contracted the disease. But the rare problem with the majority of them is that they are unvaccinated. That's the problem. The rare problem is that they're not vaccinated. That's one of very, very few breakthrough cases. The majority of people right now, I would say 99% of the people who have contracted the COVID virus are unvaccinated. And it's not difficult to find people who are unvaccinated because I meet them every day, every single day, and I keep counseling them, and they call me up and they say, Doc, what do you think? You think I should take it? And I said, are you asking a question like this at this time? When so many people have died already and so many people are infected, you are still wondering whether you should take it? I said, what do you want me to tell you? I mean, I'm getting sick and tired of trying to convince people of the need to take it, because how much more evidence you need? How much more deaths you need? How many more infected cases do you need to understand that the vaccine is going to save your life? The vaccine is going to save you from severe illness. And even if you have a breakthrough infection, that breakthrough infection is never going to be serious enough to land you in the hospital with severe illness. So take the vaccine. But I don't know, it's still, I mean, look at the numbers we have, only 22,000 are still fully vaccinated. It may have ticked up a little bit in the last maybe 2 weeks because they've had mobile clinics going around the country for the last 2 weekends. And hopefully in the next 2 weekends, which are lockdown weekends again, that more people will come out and get it, recognizing the dire situation that we are in today.
And when do you hope that things will possibly level off, and I mean, not for Grenadians to, breathe a sigh of relief, because that sigh of relief normally equates to complacency. But how and when do you think, based on the graphs and your projections and what have you, that you think we can start seeing something?
Well, as we see right now, in terms of the number of people getting vaccinated in the last couple of weeks, we're getting maybe about 1,000 odd a week. To really reach that, what we call that level of herd immunity, which I think is going to be difficult to reach now, because, at a time when we could have done a lot more contact tracing and all of that, when we had smaller cases to manage, the cat is out of the bag now, so it's a lot more difficult for the workers now to go outside and do that contact tracing. It's all over. It's all over. And so the answer still lies in the vaccine. So the more hesitancy we have in terms of getting vaccinated, the longer it's going to take for us to reach herd immunity. And for us to reach herd immunity, we have to get approximately 70% of the population vaccinated. So at the rate that we're going now, if we extrapolate from that 1,000 odd a week, I would say maybe till next year, sometime. At the rate we're going, unless there's some drastic or dramatic shift in people's thinking and people's response, and then they go outside and get vaccinations in mass. And hopefully we'll have enough at the time to give all of them, because, again, it's a limited amount that we have. So, it will take some time at the rate that we're going to get to 70%.
Mm-hmm.
So,
yeah, and I want to move on, Doc, to has to do with how this has been affecting certain sectors in society. But before that, as a Cuban trained doctor yourself, Doc, are you concerned about the situation in Cuba regarding the COVID-19?
I am concerned, and I'm concerned because Cuba is one of those countries that has embraced vaccination. They develop vaccines.
Yeah.
And they have maybe about 5 different platforms now in existence, and they have one that has been already approved. But remember, Cuba is a blockaded country. Cuba has tremendous difficulties in sourcing materials like syringes and needles and gloves and masks and all of those disposable materials. So I am concerned, because Cuba is not used to having many people die for lack of resources like that, like the availability of vaccines. But they have a vaccine that is available now. They have data, and they have
Soberano?
Soberano as well.
Okay.
And they're in the process now of vaccinating their people. In fact, initiatives are being mounted through organizations throughout the length and breadth of the Caribbean. And right here in Grenada, we have been involved in an initiative through the Grenada-Cuba Friendship Association to raise funds and to get donations of materials like syringes and needles, masks, the 95 masks, syringes of 1, 2, and 2.5 and 3 mil syringes, 22 and 23 gauge needles, and things like that we have been collecting over the last few months to send to Cuba. And the response has been very, very encouraging. And so the number of organizations within the Caribbean, Eastern Caribbean region as well, St. Lucia, St. Kitts, Dominica, Trinidad and Tobago, and others who have been raising funds and gathering material that have been sent to Cuba. In fact, we have right now a big shipment on the airport waiting to go to Cuba, just waiting on it to be collected by an aircraft. We don't know when that is going to be organized, but the materials are there right now to be sent to Cuba. But Cuba has to be admired, has to be saluted, because they are the only country in Latin America and the Caribbean who, despite the blockade and all of that, who has been able to produce a vaccine that is readily available. In fact, Vietnam just ordered 1 million doses of the other vaccine from Cuba. So Iran is another country that has cooperated with them, and they're going full speed ahead in developing it, because, as you know, as a blockaded country, they're not privileged to vaccines that other people like ourselves can readily source. And so they're being forced to develop their own vaccine, and I think they're doing a marvelous job in doing so, considering the limitations and the fact that for 60 years they've been blockaded.
Yeah. And I want to go on now to the issue of the various sectors, and specifically, which directly involved in has to do with sports, right? Doc, and for the past year and a half, almost 2 years now, we haven't had competitive sports in Grenada, albeit schools, organized school sports and things like that. So something like the COVID-19 and, the pandemic and how it has been affecting society, how do you see it to an extent affecting the sporting industry in Grenada?
Well, I mean, it's affecting everybody, everything. Schools are not opening as they should. A lot of virtual learning is taking place. Sportsmen and women are not practicing sports as they should because of the limitations where the virus is concerned. So limited access to training, limited
and physical education as well, right?
Exactly.
Yeah.
So again, unless in my case, for example, I'm a tennis player, so
right.
I practice tennis maybe six mornings a week, with the exception of Sunday, and that's because it's less of a contact sport, and even though there's still risks involved to a certain extent, but the people that I play with, they're fully vaccinated, so we cool. But we have to find innovative ways and means of dealing with that situation, because one of the hallmarks of a robust immune system is physical activity, physical exercise. And the fact that a lot of our young people are now confined to home, in front of the computer, they're hardly going out and do anything, does not augur well for the future health of the society where this pandemic is concerned. So people have to be encouraged, in the times when it is possible, to go outside there and get involved as much as they can in physical activity, so that they could boost their immune system. And in addition to that, continue to use all of the local foods, fruits and vegetables that are a very high quality, to again boost our immune system. But not only the sporting fraternity is affected, but every sector of the society is affected now, and more so, the up and coming athletes and so on. Although COVID by itself, if you have a mild infection or you're asymptomatic, you can survive. You're not going to be affected so badly. But for the real high intensity athletes, the ones that are really involved in high performances, like the Granny Jameses and so on. These are athletes that are at extremely high risk as well, in terms of if they get serious infection. This serious infection now can have, we kind of associate COVID with more respiratory symptoms, but it can have a serious effect on the heart. And one of the main things or the main complications of people who get severe COVID infection is what is called myocarditis. Myocarditis is an inflammation of the heart muscle. And for those who, for example, have comorbidities, some athletes, they might be good generally, but you don't know what comorbidities they have. And if they have comorbidities or pre-existing conditions, in addition to having developed myocarditis as a result of COVID, then they can have I mean, in many instances, they have had serious complications and death in athletes who have developed severe COVID infection. Hopefully, we're not faced with that kind of situation here as yet. We haven't seen any of our good athletes pass away because of COVID, and hopefully that will remain like that. But given all the limitations right now with COVID and what we can do and what we can't do, we can only encourage people to get as much physical activity in. Not stress yourself out too much, because stressing yourself out too much can also depress the immune system. But get sufficient exercise and physical activity in, that it would help to boost your immune system, so that in the case of an infection if you're not vaccinated, or in the case of a breakthrough infection if you are vaccinated, that you won't end up in the hospital and die.
Mm-hmm. And what are some of the, and this is general, not just for sports people, but what are some of the the long-term effects, Doc, that some people could have coming out of COVID-19 infection?
Well, as you know, again, it's a disease that affects the respiratory system mainly. So people can have long-term effects of the lungs, breathing problems, even in the case of the heart, the whole question of myocarditis and pericarditis, which affects the heart generally. And so they can have severe complications going forward that, depending on the individual, again, a lot of it will depend on you as an individual. It will depend on the state of your immune system, whether it is a robust immune system or not, whether you have comorbidities or pre-existing conditions. If you don't have any of these, your chances of survival and your chances of getting complications are very low. But once you have pre-existing conditions, you can have prolonged heart conditions or prolonged breathing problems, fatigue, weakness. There's some people who are still struggling, trying to recover from COVID, and some of these effects can be very, very lasting. I mean, even brain problems, they can have brain problems as well. So again, it depends on the state of the individual. It depends on the severity of the infection that they have developed at that particular point in time.
Mm-hmm. And Doc, as it relates to the vaccine, and now we're hearing that possibility of vaccine for the kids, and things like that. You see that probably in the next year or two that there's a possibility that the entire they can cover vaccination, I should say. The elderly, those in the middle, and even the toddlers will be able to get vaccination.
Yes, and hopefully this experience would have taught us something. And the fact that children can also develop it, because we've had a number of children in this period that have become severely ill. I think we may have even had a death or two among really young children. Hopefully, we would have learned something from that. And as I said before, what strikes me is the fact that we have a very, very good, even exemplary vaccination system in Grenada. Children are vaccinated right through school age and whatever. Even before they go to school, they have many of their vaccines. And we never had a problem with vaccinations until now. This is why I'm so surprised at the way people responded to it, because we vaccinate our children right through and we don't question anything. Now that we understand that it affects children, and especially with these new variants that are coming out, we don't know when the next variant comes out. We have the mu now and whatever it is, it might affect children. We don't know. A lot of studies, this is a new thing, it's a novel situation. So it is constantly changing, the science is changing, the response rate is changing. And we know now in the United States they have approved a vaccine for children. So it means now that we have to follow that example again. we had to cut out this nonsense about believing that the vaccine is going to kill you, and embrace the science that says that the vaccine is there to save your life. So if it means that we have to go now and immunize all of our little children just as we have immunized them against measles, against mumps, against rubella, against polio, against tetanus, against hepatitis A, B, and C, and all of the different ones that we have embraced, that this is just another one. And we'll have more coming in the future. And we have to understand that, and hopefully that in the next time around, if we ever have to face a situation like that, we'll be among the first to go and get ourselves vaccinated and understand that if you don't do that, sometimes that is the only choice you have. And if you don't do that, then you're not only putting yourself at risk, but you're putting your family at risk, you're putting your neighbors at risk, and the entire population as a whole. So hopefully, coming out of this, we have learned something. I hope so. I mean, I don't know. I just can't say, because when I expected people to do what was the right thing, we didn't do that. And hopefully we can learn a lesson, a big lesson, because I don't think it should take 85 deaths or 100 deaths and over 5,000 cases of infection in this country for us to learn that. It is a sad lesson to learn. And we should not be learning that lesson like that, especially when we did such a good job managing it, and especially when we have a culture of vaccination in the country that has been always positive. You know, I don't know where we got this culture of, the vaccine this and the vaccine that and the vaccine will do that and the vaccine will do it. When at the end of the day, as I mentioned, I continue to mention, what is doing something to you is not the vaccine. The vaccine is helping you. The virus, the COVID-19 virus, which is something that we never expected to come about, but we have a history in the world of pandemics. It's not the first one, it's not the second one, it's not going to be the last one. But understanding that it is something that can be managed, that we have the tools to manage it, that science has reached such a level of sophistication that within a matter of a year, they were able to produce a vaccine to fight this pandemic. That we ought to applaud that, instead of just throwing cold water on it and making it look as if it is the worst thing that happened, when it is probably the best thing that has happened to us in fighting this pandemic. That we learn that lesson. That is a hard lesson to learn, but we have to learn it. And in the future, embrace the science, show people that we are intelligent people, that we can understand. When the scientists speak, that they're speaking from a position of authority, from a position of knowledge. And instead of embracing the disinformation and misinformation, that you embrace the science and go forward with that.
Mm-hmm. And Doc, it's also pointing in the direction that not too long from now, the being vaccinated will be the go-to, meaning that you will have to be fully vaccinated to accept services, to board a plane, to take a cruise, and that is where it's headed.
Even for school, it's going to become a norm again, as one of the other vaccines that you have to take before you go to school. Just as though the flu vaccine is becoming something that you have to in the United States, you must take that every year as well.
Yeah.
So it's just one of those things, and especially now, I don't see any reason why that should not be mandated, to be really honest, because the unvaccinated are the ones that are posing the biggest problems for the rest of the people. And, to go on a cruise ship, I don't see, I saw the governor of Florida.
Mm-hmm.
Remove mandates for people to go on a cruise ship. And I can't understand, even from the cruise ship point of view, how they could accept people onto a cruise, not knowing what the status is, because that's one of when the thing just started.
Yeah.
It hit a lot of people who were outside there when it just really started, and people had to stay outside in the sea for a long time before they could even come back onto shore.
Yeah.
So right now, to not mandate being fully vaccinated to go on a cruise ship, I think it's irresponsible. It is dangerous, it's deadly, because until this thing comes fully under control, and we know the United States is not under control by any stretch of the imagination.
Mm-hmm.
In fact, it's because of the different states and the different laws and the different governors, whether they're red or whether they're blue or whatever it is, it has reached a stage where nothing is uniform. And if there was a mandate, you see, Grenada and small countries like ours, we have more possibilities to mandate something like that than the United States that has this heterogeneous kind of population. But I can see being fully vaccinated being the norm for the future, and personally, I have no problem with it.
And how do you see us going forward, Doc, to continue the messaging and with the hope of getting over and convincing those who are on the fence in particular to get vaccinated? I mean, it's a humongous task in terms of the the fake news, as we would say,
Right.
and as you rightly said, with social media at their fingertips now, where we have so many YouTube doctors, as they will say, YouTube and Facebook doctors. It's a big task for people like you and others on the front line, Doc.
I'm telling you, it's not easy, Michael. It's not easy at all. I'm telling you that I'm up to my forehead in terms of trying to educate people. A lot of times I just have to just put a man in disgust and say, do whatever you want, because I can't convince you. But I'm not a defeatist person, and I've never adopted a defeatist attitude. I continue to educate people as much as I can. And I mean, every day the people that call me up and they ask me, Doc, should I take the vaccine or whatever concerns them about it? I try to allay their fears and tell them, listen, the bottom line is that the vaccine is going to help you. Go and take the vaccine. Please run and take it. Because the longer you take to take it, the greater the chance of that virus mutating again and coming back with another strain that the vaccine might not even be able to deal with. And I try to point out to them that the original virus is not the one that we're dealing with now. The original one, we have been fully effective, the vaccine will have been fully effective against it. Now we have one where we're struggling to get to the percentage that we would have gotten with the original one. So this thing, the longer you take to get a vaccine, the more time you give this virus to mutate again and to come up with a new strain. And we're just going down the line. We don't know what the future is going to be. So the important thing right now is to get that vaccine. And every instance that I have where I can try to convince somebody to do it, I'm doing it. And whenever I do my articles as well, which I do on a weekly basis, I try to focus on that and try to encourage people to take it. But I'm not giving them a pass on this one. I give them full licks when it comes to the way we have responded to this latest version of our experience, where because of us not accepting responsibility and not doing the things that we should have done, we could have played a mask. I don't have a problem with playing a mask. If you want to play jab, take the jab, and it would have been a lot easier in terms of not being able to spread it as much. But people don't want to do that, and then they still want to go outside in this irresponsible manner and do what they want to do, and lead us into this situation today. So, again, as I say, I'm not blaming the government. I'm not, in a full way. I think the only thing I blame them for, as I said today, was they should have shut down everything around Carnival time. But as we say, hindsight is 2020. We can always say that only now because we're in this situation today. But given the experience of last year, when people defied the law the same way and were outside there doing their own thing, knowing that this year where the thing was properly managed and we hardly had any cases, where people now would feel so complacent and comfortable, we have no cases, so we go out and do our own thing. But you see, they were doing their own thing, but they weren't vaccinated. And that's where the problem really came about. And so they should have just shut it down, everything. No parties, the Wagiti parties and the Talpri parties and all of those big parties. They should have just shut down everything so that nobody would have encouraged vaccinated or unvaccinated to come outside and try to engage in any kind of carnival-like activities. But that's the price that we have to pay for complacency. That's the price that we have to pay for our defiance of the law, because the jab must play and the mask must play. And I really, really hope that we learn some very salient lessons from that experience, and going forward, that we are better for it rather than worse. Because if we continue to embrace all of the conspiracy theories and the lies and the misinformation and continue down that road, then I'm sorry to say that the future is not going to be good at all.
Doc, don't you find it strange? And as one in the front line and as a medical doctor as well, and I'm certain you have had the experience of speaking to people, that someone coming to a doctor for medical advice for whatever it is, and you as a doctor prescribing XYZ, and there's no question about what this will do or what this won't do. But when it comes to the vaccine, there are probably 1,001 questions, Doc.
That is the point. That is the whole point, because your patient come to you and you evaluate their condition and you prescribe something. All medications have side effects, reported side effects. It doesn't necessarily mean that you're going to get them, but they have side effects. And people just readily take whatever it is as the gospel truth or the recommendation from the doctor as sacred. So whatever the doctor recommends, they do it. They follow that. And more often than not, they'll get better and they report you over. The medication worked fine, and but easily that medication could have done something. They could have had an adverse reaction to that same medication, but they don't question that. And as I said before, even the vaccines that we give our children and that we ourselves have had over the years, we have never questioned them. We never asked what is in the polio vaccine, what is in the measles vaccine or the tetanus vaccine. When the time comes for a booster, every 10 years for the tetanus vaccine, we take it readily without any problem, because we know that if you get tetanus, you're going to get lockjaw and you're going to die. We do that. If the dog bites us, we go and get our rabies vaccine immediately because we don't want to get rabies.
Yeah.
And that is why it is so puzzling. It's a paradox to me that with this vaccine, at a time when science has advanced so much, when billions and billions of dollars have been spent in the development of this vaccine on platforms that have been in existence for many years and being developed on a daily basis, that in our own interest, they have come up with something that would have taken, in other times, maybe 4 or 5 years to develop. They have come up with it in such a short space of time. It's all a credit to the science that is existing today. The high level of scientific research and development. And so, for us now as a layperson, instead of embracing it and understanding that it is being developed in our own interest, rather than something to, as they think, Bill Gates wanted to put a chip inside you to control you, or it is making you magnetic so that anything can stick on you, and all of these things, which have no merit at all. These are the things that people are believing, and it is a real pity, that we have to come to that where, you go to the same doctor, and the doctor is advising you what to do, and then you trying to argue with the doctor about the vaccine doing this, and they say this and they say that, and I said, who said that? What you're saying, did a doctor tell you that? Did somebody in the scientific community tell you that? But no, this person tell me that, and that's how we go from one person to another, spreading these rumors and these lies and these conspiracies to the point where people decide, no, this thing, that's not for me. I ain't taking that. Afraid that will do something to me. And it has led to what we are hearing today. And we should not be paying that price, especially when we had such a good management of this pandemic internally up to just a few weeks ago, to August.
Okay then. Thank you very much, Doc. I want to thank you very much. Bang on time. Quite insightful, Doc, and certainly probably maybe I have an opportunity to chat with you on the program in the very near future. I want to thank you for accepting the invitation.
Anytime, make myself available. And thank you for having me.
All right, thanks very much, Doc. I want to thank you very much. Thank you very much. So that was Dr. Terry Marryshow, live from, yes, from Grenada, giving us a bit on the COVID-19. As he indicated, it's a very dire situation with he reporting some 80 plus. And when you look at the context in which, just in a short space of time, and it is alarming for me, But Doc says not so much for him because he has been following the science, he's following the trend. So, as medical experts and people on the front line, I'm certain they know what is happening. Let's see, Clev. Good evening to you. Is the problem really about fast tracking or just another convoluted spew of ignorance? iPhone took years to develop. Today, we on iPhone 13 with 24 and 25 in the waiting. Well said, And Marion Donald said, very informative. Yes. Yes, Clev, people talking about, fast tracking and too quick and whatever and, every year, so time they, updating their phones, whether they move from iPhone 10, 11, 12, 13, and things like that. So, yeah. Thank you very much, folks. That's our program from Myrtle Beach in South Carolina. Hopefully, next Thursday, we should be back in Brooklyn, New York, and or somewhere, or in Austin, Texas, somewhere. I have to check the schedule, but we'll be somewhere. Thank you very much. He was so correct. I always try to find out who is the they. Yeah. Thanks, Marian, Clef, and all the others who made their contribution. That's our program for this evening, folks. The invitation is to join us hopefully on Saturday for another program, if not next Thursday for another in our TalkSports program. Hoping that you keep safe. And for those of you who are not vaccinated, I want to urge you to consider being vaccinated to ensure that we protect others. Until then, I'm Michael Bascom. Pleasant evening.